What's up? It's Chad. So today was a first for me. I went to the dentist this morning and I was actually excited to go to the dentist, if you can believe that. So what I went to do was to get my get a consultation because I'm getting the mercury amalgams taken out of my mouth. Amalgams are the silver fillings, or so they call them, that get put in when you have cavities. They're more they use them more old school thought, but they're actually 60% silver and 40% mercury. And it's said that since they're in an alloy that they don't actually seep into your blood, they don't off-gas, any of that, but I've found that to be not true, and as have other people far more educated than myself. So anyways, I went to the dentist, got a consultation, and not only on top of the amalgams, but I'm also beginning to learn that root canals aren't so great either. I'm gonna have, I had 2 root canals done 2010, and the dentist didn't do the best job, and there's already tons of decay around them, so I have to get them taken out anyways. But so that's gonna be some fun. But anyways, there was a book that I was reading in the office. I only got to read it for about 10-15 minutes, but in case you're looking for more information on holistic dentistry, it's called Whole Body Dentistry. I can't remember the guy's name who wrote it, but it was really informative, and like I said, I only read it for about 10 minutes or so, but I will be looking to pick that one up. But for any of you who may be needing a root canal or any sort of dental work, I would recommend just checking into, just finding as much resources as you can online, in books, and coming to your own conclusions, because the dentist that I had do my last 2 root canals, he was a very professional person, very good, been in practice for about 40 years or so. However, when you have any sort of doctor that have been in practice for a while, they stop looking into newer technologies, newer findings. Sometimes, it's not always the case, but in this case, my dentist at that time, I asked him about root canals. He said, "Oh, no, it's fine, and that's not really the case. Reason being is the concept of a root canal is that you're going to, they drill into the root of the tooth, and the theory is that they'll clean all the bacteria out there and then seal it off. But the amount of area that would need to be cleaned is virtually impossible to do. So you're most likely always going to have some sort of bacteria stay behind, unless you have a very, very efficient immune system, which I don't really, because I'm always having congestion in the head. And it was a very, very interesting thing in that book, Whole Dentistry. It was stating how people who had root canals removed, how their sinus pressures would go away in a day or so, things that they had lived with their entire life, or they lived with from around the time that they got their root canal up until the time that it was taken out. So that's a pretty interesting finding. But yeah, so for anyone looking into the amalgam removals, I highly recommend you do that, because there's so much, there's different materials that can be used now that are non-toxic. They can do biocompatibility tests, so you can look into those as well. But the crucial thing is to make sure that you find a dentist that is trained in taking the amalgams out. You don't want somebody just going in there and just drilling away, because you can end up swallowing some of that. You can end up breathing in all the off gases. I mean, there's a whole protocol that somebody who's in the know about doing these types of things will go through, so make sure you do your research on that. If you do live in the Massachusetts area, Groton Wellness Center, they were pretty good. So I mean, the dentist that I saw today, it was the first time I actually went to a dentist office and spoke with somebody who I felt like I was in the presence of a healer, like bomb diggity. So anyways, that's that. If you have any questions, comments, write them down below. Subscribe, like, make funny faces. Have a good day.